You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. With us, we have an expert on the topic. He is Alaska's go-to implant dentist, Dr. Guy Burk. Dr. Burk, welcome to the program.
Hi, it's good to be here, Randy.
Good, good. Now, before we get, and I have a lot of questions about this, but before we get into today's topic, for people that don't know your practice, like who's the typical implant patient?
Well, I don't have a typical implant patient, Randy, but most people fall into two categories roughly. Some people, they've been to the dentist, they've had a lot of dental work done over the years, but they're still having problems with their teeth. A lot of these people have had root canals, they had crowns, and the root canal failed maybe, and now they keep having issues. They go to their dentist, and every time they go in, it's another problem. Problem after problem. Some of these people have spent hundreds of hours in the dental chair, and now some dentists somewhere told them that maybe they have to have dentures. So that's why they come to us, because they don't want dentures.
Okay, and who's the other group?
The second group are people who are already in dentures. Some of these people have had dentures for a very long time, but they're just not happy anymore. Their dentures are loose, they can't taste their food, they're using glue, and they decided that they don't like not having teeth anymore.
Okay, so they go. So is this true that literally on the day of the procedure, they can walk in with no teeth and walk out with teeth that don't come in and out?
Absolutely, that's what we do every day. Yeah, absolutely. So things have really changed in implant dentistry. The way I did it in the past, sometimes it'd be up to a year before you get your teeth, but we have all digital workflow now, and different workflows that we are using these days, where you can literally walk in, take a nap, and leave with teeth that are fixed in your mouth.
Okay, that's nice. Now you're big on IV sedation.
Yeah, done a lot of sedation. Our practice is kind of the sedation.
Like thousands of these.
Thousands and thousands of sedations. We've had over 3,000 sedations in our practice, multiple providers. So this is really great for denture wearers, because with as little as 4 implants, we can give them a full arch of teeth that's their teeth. They don't come out. They don't have to take them out at night.
Now what if you've been wearing a denture like, let's say 10, 15 years? You don't have enough bone to do this.
That's not true.
Okay.
So that used to be the case. I have my normal denture patient that comes in, maybe they've been in dentures for 20 years. And maybe they went to another dentist in town that said, you don't have enough bone. But that's all relative to who you're seeing. I mean, there's almost no one that's not a candidate because of quality or quantity of bone. There's always an implant dentist somewhere that can do something that the last guy couldn't. In our practice, it's really common that we get people who were told by another dentist that they don't have enough bone, and they come into our office, and it's very rare that we can't treat them. We have ways to grow bone now by doing special grafting techniques, and we're able to give people teeth. Those are some of our best patients. Some of our patients have bad breath, bleeding gums, their teeth are flaring. This is an excellent choice because, once the teeth are gone, Randy, then there's no more gum disease. We get to start over with these patients, and now they have healthier mouths than they had when they started with the implants. Backing up for a second, because we're talking about not having enough bone to do this. I had a patient come into my practice who had gone to see 3 other dentists, and all of them told her she didn't have enough bone to get dental implants. And she was really struggling with her dentures because, basically, if you have a denture and you don't have enough bone to do implants, you don't have enough bone to wear a denture either. So It's really difficult to keep those dentures in. So
what do you do?
So you get dental implants. So implants have changed the way we handle our dentures.
So why is it they weren't able to do it and you're able to do it? What are you doing that's different?
Number one is the technology's changed a lot.
Okay.
Implants have come a really long way. We have new grafting techniques that allow us to put bone where we couldn't do that before. We have better imaging now. We do everything with the CT scan.
Okay.
And actually everything is designed backwards. So we design the final teeth. I'm able to, all digital.
On a computer you're doing this?
On a computer we're doing this. We're designing the teeth first, and we're going to work backwards. So we get their face in there, and I can see their face now. So, the traditional way to do this is, it's basically like if you were building a house and you didn't have a set of architectural plans. You bring somebody in and they build a foundation, and then you have to build a house on top of it, and you don't even know where you're going. That's not the way we do it anymore, Randy.
Okay.
We go completely backwards. We start with the face, set the smile the way we like it digitally, and then we can take the CT scan, the 3D picture of their bone, and we can put the implants exactly where they need to go for their smile,
Okay.
and predictably give them the smile that we mocked up in the beginning. So it's like having an architectural set of plans before we ever start. So that means many things. It means more predictability about how the smile is going to look. It means that we can do this much quicker than before with less, sometimes bloodless surgery. We basically can get them teeth very quickly with less pain, less discomfort, and we can pick exactly how we want it to look.
How old can you be to do this? Like somebody sitting here, they're watching this, and they have a denture. So how old?
There's no age limit. I have many patients that I've treated in their 90s and successfully with implants. And
90? Why would a 90-year-old want to do this?
Because, Randy, they want to eat just like me and you.
Okay, yeah. Okay,
Yeah, I mean, when you're 90 years old, and that's young these days. I mean, I'm a pilot.
Okay.
And I fly around with a guy who's in his 80s, and he's a very famous aviator up in Alaska. And sometimes we have to fly across Alaska. A couple times a year we fly up to Nome, which is a long trip. It can be 10 more hours. And I have to tell you, this guy has more energy than I do. He works out more than I do. He can go on less sleep than I do. And so these people are really amazing. I get to see them every day in my practice.
Well, how soon can they eat? I mean, after it's all done, they're healed up.
They can eat whatever.
And what can they eat?
Right away. They can eat whatever they want.
Like a steak?
Absolutely. Steak's easy. I have a guy, let me tell you about a patient that came in recently.
Okay.
He has had a set of dentures since 1998. And he doesn't wear the lower set. That's really common. About a third of the people who come in my office that have dentures wear the lower denture in their pocket. And he said he's totally fine. He can eat most of what he wants to eat, but he can't eat nuts. And so literally, he's coming into my office to get lower teeth. And he's stating the only reason is he wants to eat nuts again. He can eat nuts. That's the thing in dental school. They say, don't tell a denture wearer they can eat nuts. That's the scary thing.
Okay.
You can eat nuts all day long with these things. Because we have something where we have 6 or more implants that are braced together. And in a lot of situations, it's stronger than what they had before.
Okay, good. Now we should mention a little bit about your setup. I guess how dental implants are done most of the time in the United States, you go to one doctor that does the imaging, another doctor that does the surgery, another doctor that puts the teeth on top. Then you send it out to a lab. In your practice, I guess you do it all right there.
Yeah, absolutely.
Even the lab?
We have an in-house lab, both denture lab and a prosthetic lab. We have a mill that mills all the teeth. Everything that we do in our office is made in-house for the most part.
So aside from convenience, what's the big advantage here?
Convenience. That's a big deal, Randy.
Okay.
I don't know about you, but all my patients have jobs and they have lives and they want to spend time with their grandkids. They don't want to spend all their time in my office.
Okay.
Right?
Okay.
So if I can make it convenient for them, and we can do this, what used to take us maybe 15 visits, and we can do it in 5 visits or less, then that is a huge deal for my patients. So besides convenience though, basically the way it's done traditionally is, you go see your dentist and then they send you out to an imaging center. And then you come back and then they may do some kind of work and then send out to an outside lab. And then, or maybe they send you a specialist to get the implants placed. And they hope that the implants are placed in the right place by the specialist for them to be able to make you teeth that look good. And then they got to send out to a lab and then they got to have communication there. And it's a hard thing.
You used to do it that way.
We used to do it this way. And there's no problem with doing it this way. But I've found that having a lab in-house means that we get better results for our patients in a more timely manner. And if I have let's say we're putting in a set of teeth and they're not quite the right shade that the patient wants, they want to go a little lighter, I can send it upstairs and 15 minutes later it's fixed. Normally that's 2 weeks. You send it out to the lab, you got to wait another 2 weeks, and they come in again.
Because nobody likes going to the dentist, right? So if you could get it done right away. Do you still hear that, by the way?
It's better for our patient. Yeah, absolutely.
Like, no offense, doctor, but I don't like the dentist.
Every single day. My patients come in, no offense, but I hate you guys. Right?
Do you have a funny one-liner after all these years of what to say back?
I don't, what do I usually say? I usually say, no offense taken. I mean, I'm a dentist. I get it. There's places you'd rather be than in here getting dental work.
So no more dentures. Do you think that's the future of dentistry? Like, whether it's 50 years or whatever, nobody will be wearing a denture as we know it today, which is just resting on the gums?
Yeah, I don't want to say anything bad about dentures. Okay, we do more dentures than anybody in town, Randy. Okay. I have a full-time technician. All he does is make dentures. And I have to say, when I came out of dental school, 2008, I joined a practice with my dad. That was a huge denture practice. We did some months over 200 units of dentures a month. Okay. So I had to get really good at doing dentures very early on in my career. And I have to say, it's a very rewarding thing. It's where else in dentistry can you give someone a smile other than implantology? go from the worst possible smile to the best possible smile. We have happy tears in our chair every day with our dentures. But the way I look at a denture is it's kind of the beginning of your journey to getting your teeth back. Maybe it's the first step for a lot of people. But
So your goal is to like give them like a couple of implants just to at least lock it in.
Well, that's an intro thing, right?
Okay.
So like that's the first step. If you have dentures and your dentures are loose, which is really common. Dental adhesives is $1 billion industry in this country. If you want to have comfort again, we can put as little as 2 implants under a lower denture, and now that lower denture is not floating around.
Like a snap in, snap out.
Yeah, they have little buttons on them, little snaps, really easy. We can add it to existing dentures. We don't even have to make a new set of dentures. And so that's kind of, it's funny. I do every kind of dentistry, Randy. I do full mouth rehabilitation. I do braces. I do Botox and dermal fillers. Pretty much everything there is to do in dentistry, I've trained myself to do, and that's what I do. But I tell my patients that the highest quality of life increase I can give a patient for the least amount of money is 2 implants under a lower denture. Because now they don't have this thing just floating around everywhere.
Nice.
And they don't have to worry about it flying out of their mouth.
Are there a lot of denture wearers in Anchorage or in Alaska in general?
Yeah, about 6% of the population of Alaska has no teeth whatsoever. So not even people who...
So how many is that about?
That's probably, we could fill the Sullivan Arena, which is kind of the biggest arena in Alaska. We could fill that 4 times just with people in Anchorage, not even the surrounding community, who have no teeth whatsoever that are in dentures.
If there's so many people wearing dentures, then why aren't they all coming in to do it?
Well, I have a couple takes
What's your take on it?
Yeah, my take on this is this, Randy. If you're in dentures, let me tell you about your life before you got your dentures.
Okay.
So you may have spent tens or hundreds of visits to the dentist over a period of time, and every time you went in, you were getting something major done. Your bridge broke or your implant failed, and it was always an unpleasant experience for you. And so, for some people, Randy, after spending a lot of money and a lot of time in the chair, when they finally get their dentures, it's a relief for them. Because,
really?
Yeah, there's no more discomfort. They don't got to go to the dentist anymore. And so for them, the nightmare is over. But, a normal denture wearer, once they have dentures, they're out of the system. They're not going to the dentist anymore.
So they don't even know their options.
They don't even know their options. They're not getting presented it. They don't know what's out there. And maybe they come to us after 7-8 years when the denture's loose again and they got a sore spot. And we tell them, hey, you don't have to live like this. You can have your teeth back.
This is like the 3rd set of teeth? You got your baby teeth?
It's like having a 3rd set of teeth is what I say. Basically, yeah, once you lose your teeth, where else in dentistry can we give people back their teeth? We can give them back their teeth that are theirs, that stay in their mouth and they don't come out anymore. Another reason they don't do it is maybe they think they're too old. And people self-diagnose themselves, Randy. They think, I don't have enough bone, or I'm too old, or maybe my doctor told me I can't get dental implants because I'm not healthy enough. And they don't even know that, I have to tell you, it's very rare that I have a patient come in that actually is not a candidate
that they
for
can do
implant.
it. Yeah, but if you're 80 years old, you're on 4 medications, 5 medications. You can still get dental implants?
Absolutely. Most of my patients in that age group, there's very few people who are in that age group who aren't on some kind of medication.
So you talk to their medical doctor if you need to?
If we need to, but I work with these patients every day, so I kind of know what different medications do. Another reason that people aren't coming in is that expense. They think they can't afford it because they count all the teeth in their mouth and they think, I need a dental implant for every one of those teeth. There's no way I can ever afford that. And that's just not the case. We can make these fixed teeth in there with as little as 4 implants. And so it's really not as bad as people think it is in their own heads.
Okay. Now I know a couple of denture wearers.
Yeah.
They never complain. Are you saying there's no such thing as a happy denture wearer?
Well, yeah, you don't hear them complaining because you're not a dentist, Randy. They complain to me. I'm the one who gets to hear about the complaints. But no, there's people who wear dentures and they seem to get by in life and they do fine. But if they knew what it could be like to not have to, pick and choose on the menu what only they know they can eat in front of their friends, not have to use glue. Absolutely. Your average denture wearer goes out to dinner and most of the stuff on the menu is off limits for them. They're going to pick what they know they can eat comfortably and they don't have to worry about their denture coming loose or anything like that. And so they're literally limiting themselves as far as what they can eat. And if they understood I have patients that they have dentures, they're not sure they want to go through this. We go through it. And let me tell you something, you can never take them back. That would be the worst case scenario. Like they will never go back.
Like once they get a new set of teeth.
Once they get teeth that are locked in their mouth and they can eat whatever they want, they never realized what they were missing out on. So
is it common they say, I should have done this years ago?
Every time.
Or why didn't you talk me into this years ago?
Well, a lot of these patients, I just saw them, right? And then we take care of them very quickly and we get them out of there. But almost every single, I've never had anyone that's had this procedure done that's had regrets about it. None of them. Most of them send in all their friends. So when we give people their teeth back, they can eat salads again. They can taste their food again. They don't have
salads are tough for denture wearers.
Salads are really tough if you have dentures. Salads, eating apples, even corn on the cob, meat, you got to cut it up in little tiny pieces and put it on the back of your denture and chew on it. Well, these patients, they brag to me. They come and look, I can eat an apple, And so, this is a huge deal for them because they in the back of their mind, they were always not confident about their teeth. They're worried that their denture was going to come loose or it was going to fly out on the floor or they're not going to be able to chew well in front of other people. And so this is life-changing for them, Randy. Like they can eat, they don't have to worry anymore. They can eat in front of their friends.
And now there are people that are watching this, your patients, stumbling onto the program, and you made a denture for them. Yeah. What's your message to them?
My message to them, and I don't even need to say this because I tell all of the patients this. When I make a denture, I think it's a disservice to not tell the patient, hey, this is your first step on your journey to be you again, to get your teeth back. But we want to get implants in this thing as soon as we can because time is bone. And here's a dirty
What does that mean, time is bone?
Well, so here's the thing. When you lose your teeth, Randy, this is a dirty little secret about dentistry and about dentures, okay? When you lose your teeth and you get dentures, it's wonderful. You look great and everything. But dentures cause bone loss. They're pushing on the bone in a bad way, and they cause bone loss. And dental implants can preserve that bone. Lots of different ways. It stimulates the bone. So basically, when you get a denture, you start losing bone the day those teeth come out. We get atrophy, right? Okay. And you literally lose your upper and lower parts of your face. So everybody's seen an old person, and they look like they have a collapsed, sunken face. And this is where the term facelift dentures comes from.
So the bone is actually going away, so their face sinks
Their
in.
faces, they're losing face
because
with
everybody's
time.
seen that. Yeah.
Absolutely. And that's going to happen when you lose your teeth. But if you have dental implants, you can slow that process down almost to a standstill. Whereas if you have dentures, it's actually going to make your bone go away faster. So we want to get them in implants as soon as possible.
So no more dentures. You might be able to wipe it out in Anchorage someday?
If I had my way.
The next generation of the Burks, right?
Absolutely, absolutely.
Now we have to mention this because Medicare doesn't cover this, Medicaid doesn't cover this, even the best dental insurance only covers a very small portion of implants. So what's the answer?
Well, most of my patients, I say 99% of my patients finance this. We have financing.
Really?
Absolutely. Most people,
you have to have decent credit.
Yeah, you have to have decent credit, but some people who think that they don't qualify are surprised at what they actually get approved for these plans. Also, sometimes we can bill medical insurance if it's if you lost your teeth because of an accident or something like that. There's a lot of times we can get medical coverage to pick it up. Or
we're born with a problem without teeth. Is that possible?
Yep. Sometimes if you we might have to work with your doctor a little bit, but we can get a lot of coverage. Surprisingly, a lot of coverage through medical. But we have financing options for those who don't. And a lot of people finance these things.
I heard about you through a New York, or I think he's in New Jersey, implant guy. He's the implant guy in New York. And he said, you got to hear what this guy's doing in Anchorage. And look, I'm not, people need to know it's a real interview. I'm not trying to side with you today. But when I heard about what you're doing in Anchorage, here in California, guys don't have their own lab in-house most of the time. They're not doing the surgery and the teeth all right there, all under one roof. So this is like the next generation of implant dentistry, where it's all done in one place.
I find that I've done it the other way too. And I find that we get the best results when everything is under one roof. Let me ask you a question.
Less people to pay too, right?
Absolutely. Let me ask you a question, Randy.
Yeah.
So do you have granite or marble countertops in your house?
Yeah.
Okay. Yeah. Who did you have install the countertops? Was it the place you bought it from or some random contractor?
Place, yeah.
Yeah, because what happens when the contractor drops your marble countertop and breaks it, right? You get stuck with the bill. So if I send you off to an oral surgeon, and there's nothing wrong. We have some very, very good oral surgeons in Anchorage. They're amazing, and I have nothing against doing it that way. But if I send you to the oral surgeon, and then let's say the oral surgeon, and we send it off to a different lab, and there's a problem somewhere along the way, what happens? Everybody points the finger at the other guy, and they say, oh, it wasn't me, it was the surgeon. No, it was the guy who designed the prosthesis. No, it was the dental lab. Listen, one thing about my practice, or our practice, is if you have a problem with your implants in the first 3 years, there's no risk to you because we did everything. So if your structure breaks or something like that, if your teeth break, if your teeth break, we're going to cover it 100% for you. We're going to replace anything that broke, and we want to make sure that our patients leave with teeth that are going to last them a long time.
And these are permanent teeth. I mean, I mean, people take care of them.
They
just
don't
like
come out of
your
your
own
mouth.
teeth.
I can take them out. They can't take them out. And most of the
But
time,
they can last forever, possibly?
Absolutely. Yeah, well taken care
What
of.
about gum disease? So if somebody has bad gums, can they still do this?
That's the best part, Randy. The patients who have bad gums, they have had difficulty their whole dental career, as we would call it. When you take the teeth out, the gum disease goes away. You have to have teeth to have gum disease. So we get to start over. So when we put the implants in the bone again, it's like having new roots, and the pockets are short, and everything's cleaner. And so they literally have a healthier mouth. The bad breath goes away.
Okay.
They don't have any pain on chewing anymore. And so a lot of times we can give them teeth that are much better than what they've had for the last 30 years.
Now, when they go to your practice, I think you told me this on the phone, that some people, they go in, no teeth, walk out with same day with a full arch of teeth, upper and lower, that don't come out. And you say sometimes they have like amnesia or very little memory of the procedure because of the sedation.
So yeah, so
is that true?
Yeah, so I've been doing sedation about as long as I've been doing implant dentistry, and I've never had anybody who remembers everything about the procedure. So the great thing about IV sedation, we use a lot of IV sedation in our practice. So you come in, and we put a little IV in your hand. I'm very nice. I numb my patient before we stick the IV in. They take a nap. They wake up and they say, "Are we going to get started?" And I say, "We're already done." And they have teeth in their mouth.
And you're monitoring what? I mean, how safe is it?
Extreme. So we've done over 3,000 sedations in our practice. Never had a medical complication. And I have to tell you, like most, I think it's safer than doing dentistry without sedation.
So like, I mean, you monitor their blood pressure.
We monitor their blood pressure. We monitor their heart rate. So for cardiac patients, IV sedation is even better. It's safer, it's healthier. So most emergencies you have in the dental office, and I've gotten to see them because our office is rather large. We see about 60 plus patients a day. Once in a while we have a medical emergency. They're always stress related. So stress is the number one issue in the dental office because 70% of the people out there have a fear of the dentist. They come in and their heart rate's already 10, 20 points up. But it's amazing. It's almost it's almost therapeutic. So these patients come in and they have an IV sedation. And a lot of these people have had a really bad experience. It's another reason they don't come to the dentist. In fact, that's almost the number one reason they don't come to the dentist is that they had a bad experience when they were young, so they don't want to go to the place that caused that. When they come to us, it's life-changing. We can have them take a nap, give them teeth, they leave, and a lot of times if they have to come back and get any other work, they don't need the IV sedation the second time because we've erased some of those bad experiences for them. They've had such a good experience. In fact, in our practice, we say if you don't have the best dental experience you've ever had, we don't charge for the sedation. The sedation's free.
We're short on time, but you are a dentist. You probably think that, like, the smile's one of the most important things.
Absolutely. Like, listen, it's in every single survey ever done, whether that's Men's Health or Cosmopolitan, the smile is either what people look for in a mate. Is either number one or in the top three every single time.
Yes, that's okay. I'll agree with that.
So your smile, it can be the difference between getting a raise or a job. There's study after study that shows that people who have a nice smile are 60% more likely to get a raise. It can find you love. I mean, for a lot of people, it's a confidence builder because let me tell you something about people in general. Okay. So if you have something you don't like about yourself, okay, it's going to hold you back. You're not going to smile as much.
Good point.
And if you don't have the confidence to smile, then you're not going to want to ask for that raise. You're not going to want to ask that person out. But it's amazing. I see this every day. Somebody comes into my office and maybe they just say, I don't want to, I just want to be able to chew again. I don't really care about the smile. We give them that smile that looks great. All of a sudden, they're smiling more. Maybe they get a new job. They change their whole life around.
They do selfies on Facebook and Instagram with their new smile.
I had a patient, I don't know if we have time for this, but I had a patient who came in and he basically had like 2 or 3 different makeovers by different dentists, and he was a clencher and a grinder, and he trashed his teeth, and he didn't care. And he told me, he said, you know what, I don't want to spend a lot of money on my teeth because I hear this all the time. I don't know how much longer I'm going to live, so I don't know if I want to spend a lot of money on my teeth. So finally, he decided to get his teeth fixed. We fixed his teeth. The transformation that this guy had was amazing. All of a sudden, he was smiling more. He was, telling me about how great life is with his kids. And he comes in and he loves his teeth. And he's confident now. And so sometimes that little bit of change can change everything about your life. Just being confident that you have a smile, that you're comfortable wearing.
We were talking on the break that that like in Hollywood, if you want to make somebody look poor, the director always makes sure that they have bad teeth.
Listen, we live in a very judgmental society. People judge you based on your teeth. And I had a patient who she had made some bad decisions, and she came in and she was literally at rock bottom. She was very sad. She came in and her teeth were a wreck, and she had had some drug use problems in the past. And she came in and she was crying in my chair. And she had just recently had a baby girl. And she said, listen, I want to get a new job. I lost my job. I want to get a job. I want to turn my life around for my daughter. And I can't do that if I don't have a smile. So we changed her smile, and you wouldn't believe the transformation that this young lady had.
So it's like self-confidence comes back.
It was amazing. She started dressing nicer. She became a fitness model, actually literally a fitness model. She went to a fitness competition and won. Okay. And now, today, and I'm still lucky to call her my friend many years later, today she's one of the most positive, energetic, beautiful people I know. And it was all the little step that she had to take to change everything in her life was just getting a new smile again.
So it can be done.
It can, no matter how we do it every day.
We are completely out of time, but could you, and I'm going to rush you here, options for denture wear. Okay. So somebody comes in, you can't save their teeth, maybe a full mouth of extractions or dentures. What are their options when it comes to
So we can
implants?
do 2 or 4 implants under lower or upper denture with snaps. Sometimes we can cut the palate out of the upper denture. Or we can do a fixed option, which is basically you get rid of your dentures, you don't have them anymore. You have your teeth back. They're bolted in, they stay in your mouth. Maybe we take them out once or every other year to clean them, but basically you take all that stuff off pushing on your gums anymore, no more denture.
But the upper's fine, right? Because of the suction on a
Randy,
denture?
you obviously have never worn an upper denture. I have a patient who is a chef, and she needs to taste her food. A lot of our taste comes from that palate. Okay. And if you're drinking hot coffee, you got to worry about it going to the back of your throat and burning you. So one of the biggest complaints I hear from denture wearers is that they want to be able to taste their food. They want their palate not to be covered anymore. It causes sores. So when we could take that away, that's a huge quality of life increase for our patients.
All right. Well, look, we're out of time. I want to thank you for coming to the show. So no more dentures. Now, final message. Somebody watching this, they're either bad teeth that all have to come out, and they're headed to dentures, or they're currently wearing dentures. They've heard what you had to say, but for whatever reason, they're still afraid.
Okay.
Or maybe they think they're too old. What do you say to them?
Stop holding back. Don't be afraid of what, you can come to our office, and in an hour, we'll take a free CT scan, show you what we can do for you, show you what it's going to cost you, and there's 0 risk to you. See what life can be like. I mean, this isn't about implants, this isn't about teeth or even dentures. It's about smiling and laughing and jumping with your children and, all the fun things you can do in life. So
Free consultation. Do they still get to see you?
They get to see me.
All right. I want to thank you for coming to the show. Good stuff. Really good. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.